Good evening, everybody. This is, I think, our 8th or 7th or 8th show of Call the Doctor. My name's Dr. Mark Perlmutter. I have special guests tonight to really address the topic of advances in foot and ankle surgery. I first met the senior member of this group, the Purvis-Moyer group, about 7 years ago when the founder of the group, Dr. Carl Purvis, worked with me at the Nash Hospital, and he was just the gentleman's gentleman. The first time we met, he was a little put off because orthopedists and podiatrists somewhat compete with each other for the same type of work to some degree. And then when I told him that the best podiatrist I've ever met put me through medical school, my father, it kind of broke the ice and we became friends. Shortly after Dr. Moyer joined the practice, and our conversation reiterated.
It was the same conversation.
It was the same conversation.
He was very tickled to come back and talk to me about how your dad was a podiatrist, and he was very excited to have met you.
And that sense of competition doesn't really exist between us, because although we even trade patients back and forth academically so that they end up with the best outcome, and we've done that for years. And the point of this program is that you don't have to leave the area for quality care, and that I can bring, as I have on previous weeks, people who are technical business competitors of mine to show to you that quality health care is available in our demographic, in our region. You don't have to travel out for the state-of-the-art medical care. So let's start talking about the Purvis-Moyer Medical Center, Foot and Ankle Center, and there's one member that's not here today. She's the daughter of Dr. Purvis. She's a fabulous podiatrist. Her name's Jennifer. Unfortunately, she couldn't come today. So we have 2/3 of the group here today.
Yeah.
So.
Unfortunately, not the good 2/3.
Yeah.
The other third was here would be perfect.
The best-looking third is not here.
Correct.
All right. So, at any rate, let's start off talking to Peter Moyer.
Yep.
And give us your assessment of the recent history and the development and the growth since, and even before Dr. Moyer retired. And by the way, we're about at a 2-year retirement since his passing, and he's been in our memories ever since. He was just an institution in this town, very beloved. And for a doctor to be loved by virtually every other staff member and by every patient that crossed his path, that speaks volumes years after he's gone. So share with us the history of the Moyer's Purvis Center.
Yeah, so the practice started roughly 46 years ago, and I do believe we're in the same location that we've been in for that long of time. He started the practice with his wife, Kathy, who was an RN, and they built that practice up, put both their kids through college through that practice, and then he got busy enough where he needed to get a partner. He spent many years trying to find one, and I met him at a conference, and we just kind of hit it off right off the bat, talking. And since then, we've been able to really, since it was one person, now he had added me to the practice, we were able to give better care, and the wait time wasn't as long. And then Jennifer Purvis came on, which even helped more. And then we had the passing, unfortunately, of her father 2 years ago, and that gave us an opportunity to kind of talk to Dr. Martin about coming on and joining the practice to really support what our community needs.